Experts around the world are cautiously optimistic that COVID-19 will soon become endemic, with the Omicron variant causing less severe infections. U.S. vaccine maker Moderna is starting its next phase for a booster against Omicron. Let's bring in Moderna's Chief Medical Officer, Dr. Burton, joining us now from Princeton in New Jersey. Dr. Burton, thank you so much for joining us. The Philippines currently has 13 million doses of the Moderna vaccine to date. For those who have been immunized with the primary doses, will it prevent them from getting infected from Omicron, or is the booster essential?
Rico, thank you so much for having me. Good evening. Look, it's a great question. I think the simple answer is the best protection comes from primary vaccination coupled with the booster. We see that all around the world now, multiple different data sets. As you say, Omicron has surged. It's caused a lot of hospitalization, even death. But best protection comes from that double vaccination. Get primed and then get boosted as well.
Because, Dr. Burton, this Omicron variant has seen the Philippines see a surge in infections to record highs, more than 30,000 per day about 2 weeks ago. But we're now seeing those number of cases dwindling to about the 15 to 18,000 infection rate on a daily basis. So does this mean, doctor, with the primary doses and the booster, this will prevent fully vaccinated and boosted individuals from getting admitted to hospital and death?
Rico, the data we see says that if you've been primed, had your primary vaccination, and you're now boosted, you have good levels of antibodies. Now, as time goes on, those antibodies do wane. So by 6-7 months, they begin to come down, but there's still good protection. But what we see, and we see this in the United Kingdom, United States, and Singapore, if you are primed and boosted, you have a very low 97% reduced chance of being hospitalized, dying, or getting COVID. If you do get COVID, it will be far less severe and far more manageable. So getting boosted right now is providing great protection.
Getting primed and boosted protects you from Omicron. When do you see the need then, doctor, to get boosted again? Once you have these 3 doses, every 6 months, every year, especially with the possible emergence of new variants in the near future?
Yeah. So Rico, look, I think many people now between November, when we started to hear about Omicron, today, have either been vaccinated or they're now getting boosted.
Right.
I think they're going to have good protection throughout the rest of the winter, into spring and into summer. As we go into the autumn, I think levels of immunity will begin to drop.
Right.
We have to make sure that we can protect people. As leaders in mRNA and as leaders in COVID, it's on us as Moderna to make sure that we have good vaccines available to protect against Omicron, to protect against Delta, to be honest, Rico, to protect against whatever comes next. So our prediction right now is that there will be a need for an additional booster, probably in the September-October timeframe of 2022.
So that's still another 8 to 9 months from now, Dr. Burton. Tell us, you have basically hit the headlines with Moderna's Omicron-specific vaccine. What is the status right now of this booster vaccine?
We started, the first person was dosed on Wednesday here in the United States. That study is the first of several that we will likely do. It's going to enroll about 600 people. It will probably take about 2 months to do. By the time we get the people in, get them vaccinated, take some samples from them, get data, we're probably looking at data coming in about 2 months from now. So,
doctor, with all the data coming in about 2 months' time, how soon before this Omicron-specific vaccine will be available in the market?
So we think probably we can start producing middle of the year, scale up production. So from June, July onwards into the autumn, we should be able to begin manufacture, Rico.
You know, doctor, here in the Philippines, still quite a number of Filipinos are still unvaccinated, just like in the United States. What do you say to those who refuse to get vaccinated because they're still skeptical about vaccines.
Yes. Look, I think the world, Rico, is fatigued with COVID, fatigued with the need for vaccination. And I understand that completely. But know this, Delta is still out there. And that is a virus that can kill people, certainly hospitalize them. Omicron, because of its transmissibility, also hospitalizes and does kill people. If ever there was a time to get vaccinated and get boosted, it's now. And I think I can give people confidence. The Moderna vaccine, for example, has been used in 400 million doses, Rico, now around the world. We know pretty much everything there is to know about this vaccine. It's extremely safe. It's extremely protective. The best thing you can do for yourself, your loved ones now, get vaccinated and get boosted.
So, Doctor, when can the Moderna vaccine be administered on the younger population from 5 to 11 years old?
Yes. So we have authorization in adolescents for 12 to 18-year-olds in many places around the world. We've just submitted recently our data for the 5 to 11-year-olds. So we'd be hopeful that those approvals will come perhaps in the next couple of months, as regulators need to keep looking at the data. And Rico, as well, we have a study in 2-year-old to 5-year-olds, and you'll know that Omicron has disproportionately impacted those littlest kids. That study is fully enrolled now, and we had announced earlier this year that we hope to have data there in March. So we should soon have data across the full age range of children.
What is your overall view of this ongoing global health crisis, Dr. Burton? Is this the beginning of the end of COVID-19?
I think, Rico, look, we'll be able to get from this pandemic phase into the endemic phase. We won't eradicate this virus, I do not believe, but we can learn to live with it. Some hand washing, some mask wearing, some distance, coupled with vaccination and boosting regularly, really should help us keep it under control. But, there is, for example, this so-called stealth variant, BA2, that has suddenly now come out. So I think what we've got to do is to be very vigilant. Now is not the time to let our guard down, but keep watching this virus and be prepared for its shifts and turns.
That stealth virus and that stealth variant is also here in the Philippines. So with the primary doses and the booster, Filipinos will also be protected from the stealth variant?
Yes, we're testing that now as well. What we know is that the BA2 variant is similar. It has some differences to Omicron, but it has many similarities. So I would predict right now that people who have been vaccinated with our mRNA 1273 vaccine have great protection against Delta, against Omicron, and I would think against BA2 as well right now.
Thank you so much for the very important information that you have shared with us on CNN Philippines. Dr. Paul Burton, Moderna Chief Medical Officer, joining us from Princeton in New Jersey.